All right, good morning, everybody. We have one more minute. We'll let people keep moving in. My name's Luke Thornton. I'm the WebEx host for this meeting, and the video is recording, and we are out of the practice session. For all of our participants, we ask that you remain muted, and if you have a question, you may raise your hand down at your bottom right. You should see a tiny little hand for you to raise. Also, the best way really to ask questions for the presenter is to use the chat window, and down at the bottom right, you'll see the chat button. If you press that, it will open the chat, and then at the bottom, you'll see it says to everyone, but what I ask you to do is to message just me, the host, and then when we move into the question and answers, I will read your questions off to our presenters, and then he will be able to answer the questions for you. So moving on from there, I'll pass this over to Gretchen to start us off.
Good morning to all this first day of October. We're actually feeling like fall today rather than summer or winter, so that's a good thing. My name is Gretchen Lopez, and as chair of the Seniors Council of Douglas County, I welcome you to today's virtual meeting. Douglas County and our county commissioners are making our monthly meetings possible by providing the technical support we need to make it happen. And today our technician is Luke. He introduced himself, and we appreciate all his help. And we extend our heartfelt gratitude to both the county and the commissioners to make that happen. We'll be sharing lots of important information with you today, so you might want to have a pen and paper handy to take notes or to jot down some questions. You'll have the opportunity to ask your questions at the end of the presentation, and we want everybody's questions answered, so being prepared would be very helpful. As we continue with the ongoing challenges of COVID, you or someone you know may be wondering about the testing sites in the area. Currently, there are several testing locations in Douglas County. They're in Lone Tree, Castle Rock, Highlands Ranch, and of course, Parker. Testing events run from 9 a.m. through 3 p.m. from now through December 30th on most weekdays. There are some holidays thrown in there where the testing sites will not be open. The tests themselves are free, and pre-registration is necessary. And to check on eligibility requirements and or to make an appointment, you can do one of two things. You can text COVID to 720-902-6398. I'll say that again. You would text the word COVID to 720-902-6398, or you could submit your questions to this address, events@stridechc.org. So the word events, EVENTS, at stridechc.org. And a schedule of the testing events will be included in our First Friday update, which will be going out tomorrow. And I'll share how to sign up to receive those updates at the end of the meeting. So that would be something you might want to jot down. Now, you may recall we were researching the possibility of bringing a Cycling Without Age event to both Castle Rock and Parker. And after much deliberation and a careful review of the COVID strategy guidelines provided by the Tri-County Health Department, we've decided to forego these events at this time, and we'll consider hosting them in the future, perhaps in the spring. We're going to wait and see how the COVID situation is then, and if possible, bring those events to you. We have exciting news about some new publication opportunities. We recently confirmed an agreement with 50 Plus Marketplace News for a column called Senior Voices. You may be familiar with this local newspaper, and we'll be providing articles to them for publication on a regular basis. Now, 50 Plus Marketplace News has several distribution sites in both Parker and Castle Rock. Some to include Parker and Castle Rock libraries, the Parker and Castle Rock senior centers when they reopen, the county building and courthouse, and Douglas Elbert Task Force office, and many, many more. For a location closest to you, you might want to give them a call at 303-694-5512. That phone number again is for 50 Plus Marketplace. If you want to find a distribution site closest to you, you would dial 303-694-5512. So we're pretty excited about that. You may be aware that we already have a very strong and wonderful working relationship with the Colorado community media and the papers that are thrown in our driveways. We have an ongoing article there. So we're pretty excited about adding this to our ways of reaching out. Now I'd like to introduce Tiffany Curtin, our education chair, who will give us a report on upcoming presentations, and then introduce today's speaker, Dennis DelPizzo. Tiffany?
Thank you, Gretchen. Next month, on November 5th, we will have a presentation on the SHIP programs, the State Health Insurance Programs, by Jean Analt. And so the SHIP program helps navigate Medicare, understanding coverage, eligibility, your rights. So we're looking forward to having that presentation on November 5th. In December, we'll have a presentation on using social media and Facebook to better connect with people and share information. And then in February, we will have a presentation on evaluating information that you receive through social media, how to know what is good quality information, some tools to help you kind of navigate things that people send to you or you receive in your social media accounts. Today, I want to introduce our speaker, Dennis DelPizzo. He is the health insurance specialist of Central Affairs with the Centers for Medicare and Medicaid Services. He has been with CMS since 1998 and is primarily focusing on outreach in Colorado, Montana, the Dakotas, Utah, and Wyoming. And so now I present to you our speaker today, Dennis DelPizzo.
Well, thank you so much, Tiffany and Gretchen, for the opportunity to this event. And hard to believe, October 1st already, and that is something with Medicare that is an important date. That means that open enrollment is right around the corner. And I wanted to start by sharing some slides with us for some discussion points, and hopefully will aid in some of the conversation and dialogue that we want to have. And then I just want to make sure that it's another resource and aid for us as we discuss the Medicare open enrollment period and what that means for us, and some of the options and choices and decisions that we might or might not make depending on our individual circumstances and situation. And we want to talk about that. So in my discussion today, primarily three items I want to mention: the open enrollment period, give you some touch on some 2021 updates that we want you to be aware of, and then of course Medicare resources. And you might walk away from today's presentation saying, I wish I would have asked this question. Well, always remember that there's help for Medicare beneficiaries every step of the way, whether it is online and you want to go out to the Medicare.gov website, whether you want to do it on via the phone and call our 1-800-Medicare call center that's available 24 hours a day, 7 days a week, or as Tiffany mentioned, and you'll discuss next month, the State Health Insurance Information and Assistance Program. And this is a program that is funded by the U.S. Department of Health and Human Services. And every state has a SHIP program. In Colorado, that SHIP program is administered by the Colorado Division of Insurance, and they provide neutral, unbiased counseling and assistance to Medicare beneficiaries. So there's also an opportunity to get help, not only nationally, but also locally within the community. And that's where a SHIP counselor can be a great resource. And of course, we'll provide the contact information as we move forward here. So let's first talk about the Medicare Open Enrollment and what it is and what it means to everybody in the time periods that we have to take a look at 2021 plan options and choices, see what's available to us, and then factor in how is our plan working? Did we have some issues or concerns, or didn't like how it covered certain things, or I didn't like that it didn't have certain providers that were convenient to me, and I want to maybe look at what options might be available, or it wasn't covering all the medications that you take. Well, that's what open enrollment period is all about. But first, wanted to start with a basic discussion. And so we might have some people joining us today that are brand new to Medicare, and they have, they're just starting to digest some of the stuff and prepare. And so real quickly, just wanted to mention to you, Medicare is a federal health insurance program for 3 groups of people, age 65 and over, under 65. So we can have people under 65 that qualify for Medicare because of disability, and that's usually a permanent disability, or people that qualify for Medicare due to end-stage renal disease, which is permanent kidney failure. And we all, once we go to enroll in Medicare, we will all go to the Social Security Administration. And so CMS, the Centers for Medicare and Medicaid Services, who I work for, we work very closely with the Social Security Administration, because every one of us, when we go to apply for Medicare, will go through the Social Security Administration to apply. And one of the common questions we get is, well, what if I don't want to draw Social Security, but just apply it for Medicare? Well, you can file a Medicare-only app. But once we have enrolled in Medicare, we have primarily 2 choices and 2 options. So Congress wanted to set up Medicare coverage match or be very similar to our employer group coverage. And that is, they want us to have some options and some choices in how we receive our benefits. And so on the left-hand side of the screen, Original Medicare, well, that's the program. We call that either Original Medicare or Fee-for-Service Medicare, which includes Medicare Part A hospital insurance, Medicare Part B medical insurance. And so once we fully retire and are no longer working, Medicare, most people with Medicare have both Part A and Part B. If we decide to stay in Original Medicare, so once we apply through the Social Security Administration, we're automatically put on the left-hand side, because the government can't pretend to know which plan option might be right for us. We have to tell the plan that, hey, after research it and making an informed decision, I would like to enroll in XYZ Medicare Advantage plan, or ABC Medicare prescription drug plan. That's something we have to decide on our own after making an educated, informed decision. And as I mentioned, there's help every step of the way. But on Original Medicare, once we have applied and have enrolled in both parts of Medicare, we always encourage people with Original Medicare to seriously consider adding Medicare prescription drug coverage. And also, if we're not fortunate enough to have retirement coverage provided by a former employer, to add a Medicare supplemental insurance to our original Medicare coverage. What a Medicare supplement does, and you notice you will not see Medicare supplement on the right-hand side of the screen. Medicare supplement is designed to fill in the costs and the coverage gaps that original Medicare doesn't fully cover. So like with our employer coverage when we were working, Medicare doesn't pay 100%, so we have some out-of-pocket responsibility. And Medicare doesn't cover everything. But the costs that are remaining once Medicare is covered, that's where a Medicare sup can be very beneficial to somebody with original Medicare. On the right-hand side of the screen is Medicare Advantage. And you notice in Medicare Advantage, and to even be eligible to apply for Medicare Advantage, we have to, at a minimum, be enrolled in Medicare Part A and B. And so it requires us to have both Part A and Part B medical and hospital insurance to be able to be eligible to enroll in Medicare Advantage. And then this is where we would make an educated and informed decision on deciding to say, I would like to enroll my Medicare benefits into a Medicare Advantage plan. And these are private companies that contract with the federal government to offer everything that's included under original Medicare Part A and B at a minimum. And a lot of times, and you'll see the bullet that says extra benefits. Most of the plans provide extra benefits as well, and they do include prescription drug coverage as well. And so they become very, very popular. There's 49,000 Medicare beneficiaries in Douglas County right now, and about 51% of them are on the right-hand side. They have chosen to make a decision to enroll their Medicare benefits into a Medicare Advantage plan. And so 49% are over on the left-hand side. They've chosen original Medicare because that's right for them. And that is, each and every one of us have to make an individual decision. There's no such thing in Medicare as family coverage. It's individual coverage. So each and every one of us have to apply through the Social Security Administration. And then once enrolled, we have to decide which coverage is right for us. And if we choose to enroll in Medicare Advantage, we have to tell the plan via another enrollment into that plan that we want to enroll our Medicare benefits in that plan, because it works with my doctors, it works with my costs. After making an educated and informed decision and doing some homework, I see that my costs could be lower, and it's convenient to me. My healthcare providers are very convenient, the people that I regularly seek healthcare from, and so that can be a primary decision why somebody might go from original Medicare to Medicare Advantage, or vice versa. And we'll talk about some of the additional factors too, but plans are becoming more and more popular because of these extra benefits, and the extra benefits can include vision, dental, hearing, which by law, original Medicare does not cover. Now, I want to clarify for vision for medical necessity reasons. So if we're going to get our eyeglasses a prescription check, that's going to be a routine service, and it's not going to be covered by original Medicare. This is where Medicare health plans might provide coverage for that. Now, if we're suffering and are diagnosed with glaucoma or require cataract surgery, of course, original Medicare is going to cover things like that. But some of the things that are routine, preventive, and by law, Medicare by law says care related to the teeth and gums is not covered. And so over here on the right-hand side, Medicare Advantage plans could provide that as an extra benefit. They could provide additional health and wellness benefits like health club memberships. They could provide transportation benefits after a surgery for a limited period of time, possibly maybe a meal benefit or additional services that again are not covered by original Medicare. And so that's why the health plans have become very popular. And one of the other things that Medicare Advantage plans can do is lower our out-of-pocket costs through lower copays or deductibles, etc. And so it's always up to each one of us. And we could very well, it's very common for a husband to maybe be on the left-hand side and the wife to be enrolled in a Medicare Advantage plan on the left hand, or excuse me, in original Medicare on the left-hand side. And so healthcare is unique, it's individualized, and what's right for myself might not be right for Gretchen, might not be right for Tiffany. And so it's up to each and every one of us to make a decision that we want people being covered by coverage that's right for them. So it's just a real good starting point to discuss this and to see Medicare's coverage options. One of the things I do want to mention before I leave this slide is Medicare supplemental coverage. If we're eligible for Medicare Part A, Part B, we call Medicare Advantage. We also refer to that as Part C, or Medicare Part D prescription drug coverage. If we're eligible, we're in, regardless of health history, regardless of past healthcare costs. We're eligible for Medicare, we're in. Medicare supplemental plans, which is only an option for people in original Medicare. It's illegal for an agent or broker to sell you a Medicare sup if you're in a Medicare Advantage plan. And it's not designed, Medicare sups are not designed to work with Medicare Advantage, and that's why you only see them over here on the left-hand side of the screen. Medicare supplements after a 6-month Medigap open enrollment period, which occurs at age 65 or older and enrolled in Part B, generates a 6-month guaranteed issue period where we can shop and purchase any Medicare supplemental insurance that's being sold in the state. Outside of that, Medicare supplements can medically underwrite. They could say no to us. I'm not going to sell you, we're not going to sell you a policy because of your health history. So that's another thing that people have to factor in and to take into consideration. Now, if your health is good, life is usually good. But that is one of the other factors, and I'll mention this again, but a real good starting point as we get into what is Medicare Open Enrollment. So this is a period of time that occurs from October 15th through December 7th, where we have the options and choice to change our coverage if we so choose. I always like to mention, if we're happy, our coverage is working for us, we got our Medicare information from our plan that we're currently enrolled in for 2021, and it's working for us, that's fantastic. And if you're happy, the cost hasn't changed, your doctors are still in the network, or healthcare providers are still in the network, you might not need to do anything at all. And you can worry about more important stuff. But if you have had some issues, or you see that the costs have increased for 2021 based on the information, your specific plan that you're enrolled in currently will be changing for 2021. Well, it might be to your benefit and the benefit of your pocketbook to look at your options and choices. And so during the open enrollment period, during the October 15th through December 7th, you can join or switch Medicare prescription drug plans. And just to let you know, if all you need is prescription drug coverage, say you're in original Medicare and all you need is prescription drug coverage, 100% of the people in Colorado, so 100% of Medicare beneficiaries in Colorado have access to a cheaper plan in 2021, if that was their choice. And the cheapest Medicare prescription drug plan in 2021 is $7.30. I think it was $14.60 in 2020. So everybody will have access to a cheaper prescription drug plan. You can join a Medicare Advantage plan, or you can leave an MA plan and return to original Medicare, or vice versa. So you have unlimited options and choices of what you want to do. But most importantly, we want you to pick what's right for you. Your current plan, nothing's changed. The costs are stable. Providers are still in network. You could be done, but it behooves all of us to take a look. Statistics show a lot of people don't do a lot of changes in the open enrollment period, and they could be leaving some real savings. They could be missing the opportunity for some real savings. But again, we want you comfortable. We want you understanding your health coverage, and we want the coverage that you've chosen working for you. And then it's very important to take time, and this is the period of time right leading up to open enrollment period. So all of the 2021 plans, if you want to go out to Medicare.gov right now, they're up and they're live. And so you can start taking a peek at what's available. Every one of you that are on Medicare now should have received a Medicare and You handbook for 2021. Take a look at the back of that publication. It has the specific plans that are available, both Medicare Advantage and prescription drug plans in Colorado. And then if you decide to change coverage during the open enrollment period from October 15th through December 7th, the coverage would begin January 1st. So Medicare's coverage runs from 1/1 to 12/31. And if you don't do anything at all, in most cases, unless your plan is decided to leave the state, and I'm not aware of any of that happening, then if you didn't do anything at all, your coverage would roll into the same coverage that you had this year, but for the 2021 coverage would be with maybe different premiums, maybe different cost sharing amounts, etc. And just like when we were working, Medicare coverage is subject to change on an annual basis. Not only the way coverage is provided, but also costs. So always remember that as well. And that's why this is an opportunity the best opportunity to take a look and see what's available to us. This slide is just illustrating graphically the period of time. Starts October 15th, continues through November, ends on December 7th. The reason we end early in December is because we want all the system changes and the paperwork and the processing to be complete, so that come 1/1, your coverage, your cards, if you've changed plans, are sitting in your laps and ready to be used come January 1st. So comparing plans each year, like I said, like when we were working, our plan coverage changed each and every year, no different with Medicare coverage. And so if you right now are enrolled in a Medicare Advantage plan, or you're in original Medicare and just enrolled in a prescription drug plan, those plans should have mailed you an annual notice of change, or connected you with a link to your annual notice documents that highlight how is my plan changing from 2020 to 2021. Costs, coverage, formularies for prescription drugs, network providers, etc. How is that plan changing, if any? And that should be, the annual notice of change should be your telltale sign of, hey, life is good, or I need to look. Some of these costs have increased quite a bit for 2021. And not saying anything specific, I'm just saying pay attention to these documents. They're very important that can help you. And then an explanation of coverage is like your Bible. It really tells you how your plan covers certain items and services and at what cost sharing amount. And so that's also a very important resource to be able to keep in your back pocket should you need something in healthcare. A lot of times we don't pay attention to it until something's going on and we need it. But that explanation of coverage, that EOC document, could be a very good resource when you're taking a look at how is my plan going to cover this particular or service, and how much is it going to cost me? And so those are two important documents that your plan should have either provided to you or provided you links that you have access to that information and can take a look. And then, of course, Medicare Advantage plans, Medicare prescription drug plans, these are private companies, and they make business decisions each and every year to change coverage, change costs, or even saying, we're just not competitive in this market. We might be exiting, or we might be reducing our service area. And so bottom line, plans are businesses and they can make business decisions. Things to consider, and I mentioned this is one of the things. Here it is. Some of the bullets that we highlight, and I always start with doctors and hospital choice. And sometimes that could be your decision maker. You go and see your healthcare provider. Say I'm brand new to Medicare and I'm deciding Medicare Advantage or Original Medicare. What do? I don't know. And so I might start with my primary care doctor and say, you do cover Medicare, right? And hopefully the answer is yes. And in most cases it is, but he or she might tell me, but we'll only see you if you have Original Medicare, or I'll only see you if you have Medicare Advantage. And so that could be our decision maker right out of the gate. And if our doctor, if our relationship with our healthcare provider is important, that could be the ultimate decision maker. Of course, for costs, we want to get the best coverage for us at a price that we can afford and that we can reasonably afford the out-of-pocket costs. So number one, premiums. Number two, out-of-pocket costs like cost sharing, co-pays, deductibles, etc. Coverage. I'm really healthy, so the only thing I utilize right now is preventative services. Or, well, last year, looking back, and this has been quite a year, outside of the public health emergency, it's just been a year health-wise for me, etc. If that's the case, you might want to look at how does a particular plan or Original Medicare provide coverage for the tests or services that you frequently need right now. So that's another thing to look at. I mentioned supplemental coverage, and that's talking about Medicare supplemental insurance. And be cognizant that if your health is questionable and you're an Original Medicare, yes, we do give you a free look. And I'll mention this one other time in this presentation, to go to Medicare Advantage, and within that first year, return to Original Medicare and pick up a Medicare Sup on a guaranteed issue basis if you're outside of your Medigap open enrollment period. Or if you have been on Medicare and you decide for the first time after maybe your third year in Medicare that you would like to test drive Medicare Advantage and see how it works, and you enroll in Medicare Advantage and you tell your Medicare supplement that you've enrolled in Medicare Advantage and you end that coverage, first 365 days of doing that as well, you would get a free look and you would get the opportunity to go back and purchase that plan if it's available, or other plans that would be available within certain categories of Medicare supplemental coverage. Prescription drugs, how well, if you take a lot of meds, does a plan cover my RX, my prescription drugs, and at what costs? And this is a huge driver for some people. I mentioned doctor and hospital, quality of care. So if quality is important to you, how well does my Medicare Advantage plan treat certain conditions? How well does Medicare Advantage plan make sure that I get all my preventive services that I require and need based on family history or current situation? How well does my plan provide customer service? Have I been able to get a hold of my plan? Have I got a lot of denials by my plan, and I've really had to fight for coverage? We take a look at all of that stuff, and we measure that, and we rank and score plans, and we give them star ratings. Those star ratings for 2021 will be available on the Medicare Plan Finder, which is something we'll talk about in a sec here, on October 10th. So if quality is important to you, how well do plans perform? And you want to look at that as a driver in your decision making and considerations, that information will be available to you too. Traveling. Do you travel quite a bit? If you're in a Medicare Advantage plan, how are you going to be leaving the network? If you leave the network, is the plan going to cover you outside of an urgent or emergent situation? So if it's urgent or emergent, regardless if you're outside of the network, the plan has to provide coverage. But what happens if it's not? How is the plan going to provide coverage while you're traveling? Take a look at that. That's something that, if that's something you do quite a bit or will do quite a bit, post public health emergency, post COVID-19, that's a factor that you want to take into consideration. So those are some of the big ticket items. There could be some other unique things that are important to you as well. And always shop and compare. And if you went through this list and said, check, I've done this, give the plan that you're considering a call. Do they answer the phone right away? Do they answer your questions? Do they follow it up in writing if you ask them that? That could be another. Ask your healthcare provider, what do you think of XYZ Medicare Advantage plan or ABC prescription drug plan? Talking to your local pharmacist. You can take it as far out as you want, just so that you're comfortable. And when you put your head down on the pillow at night, you have peace of mind. And that's what's important about insurance, is it's providing financial protection that, God forbid, if I need it, it's going to be there for me. And so hopefully these things to consider are food for thought for you. We talked about this, but the Medigap open enrollment period. So if you drop a Medicare Advantage plan and join Original Medicare during the open enrollment period, as I mentioned, Medicare supplemental plans, Medigap is another term that we use. There is no guarantee that plan is you unless you're in your 6-month Medigap guaranteed period or that trial right period. First time you join Medicare Advantage and want to return, or the first time you join Medicare Advantage while being on Medicare for a period of time and drop your Medicare supplement. That's what a trial right is. Outside of that, be careful. Now, if your health is good, life is good, but you need to watch that because these plans can medically underwrite and they could say no. But again, Original Medicare is the only time we would need and would consider Medicare supplement. How do I research and compare? Well, I mentioned a couple of sources, and that's your 2021 Medicare New Handbook. So if you're on Medicare, you should have received one per household. We mail a Medicare New Handbook if you've requested it. Now, if you've requested to get it online, electronically, you should have gotten an email alerting you that it was available. But that's a great resource to familiarize yourself on how Medicare works. You should keep it in a handy place. Kind of very similar to the phrase back pocket. Keep it handy. You might really need to access that throughout the year. How is Medicare going to cover certain things, or what is this term? It makes no sense to me. My doctor was using it. It probably is going to be explained to you thoroughly in the Medicare New Handbook. As I mentioned, the plan's annual notices of change. So how has your plan, if you're in a Medicare Advantage plan or a prescription drug plan, changed for 2021? Number one, cost. Number two, coverage. A great resource for you to remember, there's help every step of the way. So if you want help deciding, or I shouldn't say deciding, but some of the factors and considerations and questions you should be asking as you evaluate, am I good or should I change? The state health insurance information and assistance program is also, and I mentioned that, and you'll talk more about that in November, is a great resource for you. And that number over to the right of this is the local Colorado SHIP telephone number. So that is the Colorado number, but there's a SHIP in every state. 1-800-Medicare. And the customer service center is open 24 hours a day, 7 days a week. Thanksgiving and Christmas are a few of the times that they would be closed. And you might not want to call the first day of Medicare Open Enrollment or the first Monday of the month, but maybe on a Friday at 7 p.m. after dinner, I might call and get right through. And so always remember them as a great resource. And I always like to mention the state health insurance assistance programs usually operate under normal business hours, but you should always check to see if they have any hours outside of that too, so that you can schedule an appointment if you want to sit down or chat with somebody local as far as your situation and what you're taking a look at. None of these entities, the 1-800-Medicare customer service rep, a state health insurance assistance program counselor, is going to make a decision for you. Now, if you work with an agent and broker, that's perfectly fine. But keep in mind, agents and brokers are usually tied to certain companies, so they might be steering you to one particular company or not. The customer service reps at 1-800-Medicare or a counselor at a SHIP counselor is never going to steer you. They're neutral, unbiased. There's no incentive for them other than to help you and to give you the things that you need to consider as you evaluate. But ultimately, always the decision rests with you as far as which plan is right for you. And then I mentioned it in the previous slide, but the Medicare Plan Finder on Medicare.gov, there is, and it's live for 2021, so it's very prominent. You open up Medicare.gov, and on the middle left-hand side of the homepage, you're going to see 2021 plans, and you can click on that button, enter your zip code, or you can enter all your personal information to get a more detailed search as far as which plans are available, how are they going to cover certain things, and at what costs. Or you can enter your medications that you take and see which one of these multiple companies that are available to us. We're very lucky in Colorado, and especially along the Front Range, that we have options and choices in how we that to pick from. Number one, we have lots of competition, so that can seem overwhelming, but it also keeps costs down too, and it also encourages plan XYZs competing with ABC, and so they might be adding extra benefits and keeping your costs down, which is a win-win for consumers. So always remember that even though we have lots of options and choices. We hope that's a good thing. But you can evaluate based on where you live and down to the zip code level, which plans are right for me through the Medicare Plan Finder. And okay, he's done a lot of talking, but where can I see the information? The Medicare Plan Finder is going to give you great estimates of what certain plans are going to cover for certain things, medications, tests, etc. And always want to mention the plan websites as well. How to join, and remember, we join Medicare through Social Security, but after we're enrolled in Medicare, we have to join a Medicare Advantage plan or a Medicare prescription drug plan or a Medicare supplement plan by contacting the company or other enrollment mechanisms that they provide. So we can enroll or change coverage in our Medicare health coverage by calling the plan, enrolling on the plan's website, or on Medicare.gov. You have the option to enroll. So if you want to self-help, you're comfortable. The Medicare Plan Finder is a tool for Medicare beneficiaries. It's designed for you to evaluate your coverage. And if you feel comfortable using the computer and want to take a look at yourself, you can do it yourself. And if you wanted to say, okay, it's October 15th, I can change coverage now for 2021, keeping in mind it wouldn't be effective until January 1st, I can do that. But again, it has to be done from October 15th through December 7th. You could call 1-800-Medicare and the enrollment could be taken over the phone if you so choose after you have made your decision and say, hey, XYZ is the right plan for me. Or like I mentioned at the very beginning, I don't need to do anything at all. I'm good. I like my plan. It's worked beautifully for me. All my doctors are still in network. I've just verified that again to make sure it covers any of the medications that I take. It covers them as competitively as any other options that I've taken a look at. I'm just going to relax and go about worrying about more important things in life. And I've gotten this behind me so I can check that box. That's great if that's you, but there's always, this is the best time to do it and make sure. And remember, you do not have to disenroll from your previous coverage to enroll in a new plan. Your action to enroll in a different company or a different plan will automatically disenroll you at the end of the year in your current coverage. So only one enrollment action is necessary. You do not need to disenroll as well. If you have other coverage, so I mentioned this early on, but if you are one of the few fortunate people that have access to retirement benefits through a former employer or union, do not do anything until you check with your former employer and look at what your former employer has provided you as far as the coverage options and choices for 2021. Very, very important. You've worked a lifetime for those benefits. Don't do anything to harm what you've worked a lifetime for. So always check with your former employer if you have retirement coverage through that former employer or through a spouse who might have access to that. Very, very important. And then shouldn't happen. Remember I said December 7th, and we ended at December 7th so that all the paperwork, all the processing, all the membership cards complete and done and ready to go for January 1st. You should never be in this situation, but if you were and you need, say, to get a prescription filled and you don't have your new card that you changed to effective January 1st, take as much information as possible to the pharmacist, to your local pharmacy, and they a lot of times will be able to look up which coverage, which plan you're in, and look up your access to your information for that particular plan you're enrolled in to process your prescription. So shouldn't apply, but we just always like to mention it. Take as much information, Medicare card, driver's license, if you've gotten an acknowledge or confirmation letter, if you've enrolled in a new plan during the open enrollment period, take that with you. Keep important paperwork with you and handy or close by so you'll have access to it. This is just a timeline, kind of shows you what we've talked about. We start with the Medicare New Handbook. We end with January 1st, and that's when new coverage begins for plan year 2021. And then people that are in Medicare Advantage effective 1/1/2021, look here, they also have an additional 3 months to say, oh no, I forgot something, I didn't consider something, or I missed this. You have another option to make a change. And so this is nice. But this is only for people, you notice Medicare Advantage open enrollment period. This is only for people in Medicare Advantage effective 1/1/2020. So if you're in original Medicare, you wouldn't be able to make a change. So, and then we can get into the questions. This is the most important thing, is getting to your questions. But, coronavirus disease, COVID 2019. So the Medicare program has changed to accommodate different modes and different ways we get services. Number one, telehealth has been very instrumental. We can receive telehealth benefits anywhere, including our home. That's usually not the case in original Medicare. When I mentioned it down at the last bullet on this slide, Medicare Advantage plans will still continue to provide it and expand telehealth coverage that will be available if we so choose to receive it in our home. But for COVID-19 coverage in Medicare, of course, we pay, and Gretchen was mentioning about COVID testing sites, but here is where we get into medical coverage. If your doctor has a reasonable suspicion, or based on your symptoms and signs, there's a possibility you need to be tested, that's going to be a diagnostic test ordered by a doctor. It's being done for diagnostic reasons, either to confirm or rule out. And so that's where it gets into, now we're starting to use our medical coverage. Medicare also covers antibody testing. Again, we're looking at it on a diagnostic basis. It's being used for your overall management and a treatment. One of the things that is new for 2021 is with Part D plans. There's a new model operating. It's called the Part D Senior Savings Model. And on insulin, we have up to 9 prescription drug plans that are participating in this model in Colorado, and 11 Medicare Advantage plans available in Douglas County that are participating in this model, that provide $35 insulin coverage throughout the coverage phases. So throughout the deductible, the initial coverage phase, or the coverage gap phase of Medicare coverage. So we do have plans that can lower your out-of-pocket costs for insulin. There are 9 prescription drug plans. There are 11 Medicare Advantage plans that are available to us in Douglas County that are offering lower out-of-pocket costs for insulin. Medicare Advantage and end-stage renal disease. Remember, I said, or I made a statement, if we are eligible for Medicare Part A, Part B, Part C, Part D, or N, there was an exception for people with end-stage renal disease being able to enroll in Medicare Part C, Medicare Advantage. That will go away next year. So people with end-stage renal disease, permanent kidney failure, will be able to enroll in Medicare Advantage, and plans will be able to accept them and no longer not be able to except that one condition, but that was the one condition that excluded people with end-stage renal disease from enrolling in a Medicare Advantage plan. That goes away. Acupuncture for chronic low back pain. We used to always say in one of the slides, keep in mind, I made a mention of healthcare coverage, Medicare. Medicare is going to be performed very similar to our employer group coverage. It doesn't cover everything at 100%, and it doesn't cover everything. Acupuncture was one of the things we didn't cover. We didn't do we didn't provide coverage for acupuncture. It wasn't considered FDA approved. Well, now it is a covered benefit, very, very limited covered benefit for chronic low back pain. It has to be performed by a physician or a practitioner. A practitioner would be a PA, a nurse practitioner, a clinical nurse specialist, and they have to be trained in, they have to either have a doctorate or master in acupuncture or oriental medicine and have the appropriate licensure, or employ staff that have those credentials that those auxiliary staff have the credentials and criteria that the doctor or the practitioner can go on record saying that that individual is able to perform that medically necessary service, but it's only for chronic low back pain. So very, very limited benefit, up to 12 benefits if medically appropriate, and there's a benefit, and there's improvement going on, and possibly up to 8 additional benefits, up to 20 per calendar year. And then the last item is telehealth. And telehealth, as I mentioned, has been very vital during COVID-19, in that we don't feel comfortable going to our healthcare providers like we used to, or going out in the community like we used to. And so one of the nice features, some of the, like being able to shop at home, or being able to have our groceries or takeout delivered to our home, well, we can receive telehealth. We can receive our medical appointments from the comfort of our living room if we so choose. And that's been real nice. That will continue with Medicare Advantage. We can continue to receive telehealth in Medicare Advantage like we are right now. With original Medicare, once the public health emergency ends, the current declaration is through October 24th. Can't predict if it will be extended or not. I would suspect it would, but what I say has very little meaning as far as what is determined by the health experts. And then lastly, flu. Very, very, very important that we curtail the spread of disease and the benefits of the flu. I always like the CDC illustration slide of the benefits of the flu vaccine, and we encourage everyone to get the flu vaccine. Remember, Medicare in most cases covers it free of charge, and we remember that I mentioned healthcare, or we don't feel comfortable a lot of times going out to in the community as much as we used to, due to the concerns of the pandemic and the making sure that we're careful, or keeping our loved ones careful. And so a lot of times there's alternative sites to receive vaccinations, and healthcare providers too are doing additional screening and separation so that you can feel comfortable getting your flu shot from your healthcare provider, and you're going to feel safe while doing it. And so very, very important. Always like to mention it. Here's the Medicare resources, and I'll open it up for questions.
Hello, everybody. This is Luke, the WebEx host. If you look down in the bottom right, you'll see the chat window. You click chat to open it up. If you message me directly your questions, I will be able to ask Dennis those questions. And If you raise your hand, there should be a little hand raising there. If you raise your hand, I'll be able to call on you after I read the ones that get chatted in. So go ahead and put your questions in chat and we will get those to Dennis. I did get one question, Dennis, right off the bat. This is from Wendell Werner. And he said that you mentioned a prescription drug cost, but did not say whether it was per month or per prescription. So he wasn't able to interpret that.
Okay, so prescription drug costs and I always like to refer back to when we were working. So Medicare is going to be, our coverage is going to behave very similar. Number one, if we're in a Medicare Advantage plan, that coverage for prescription drug, there's probably not going to be an additional premium. So the cost would be per medication, per fill, and usually for most medications, not all, and we know that. For anybody taking medications, it's usually for a 30-day fill. There's going to be a cost-sharing amount, and that's what we would evaluate on Medicare.gov. There are, and I always like to reference this, but there are 27 different Medicare prescription drug plans. There are 46 different Medicare Advantage plans that we have available to us in Douglas County. And so if I would take a particular drug, how would I determine the cost for that medication? The Medicare Plan Finder tool is a great resource listed right here on this slide. That is a great resource out on Medicare.gov, and you can click on it. It's very prominent. You can call 1-800-MEDICARE right here. You can call the Colorado SHIP right there, 888-696-7213. But the cost is usually the copay that the plan is going to charge you for your responsibility for that particular medication, whatever it might be, for a 30-day fill usually.
Okay, Wendell had a follow-up there. He says, so just to be sure, if I have a benefit from my former employer, I should arrange everything through them?
You absolutely should. And that goes back to the slide I mentioned. If you have access to former employer coverage or through a union, do not do anything and follow the rules. If they're providing you coverage and drug coverage, follow their rules and follow their information and check with them, because if you do anything outside of their rules and instructions, you could lose that coverage, and that's something you've worked a lifetime for, or your wife perhaps could have worked a lifetime to earn. And so always follow those rules and check with your former employer. Yes.
All right. Wendell says, got it. Thanks. So, thank you, Dennis. Question from Ted Webster. As we get older, our doctor is recommending getting the shingles shot, but Medicare does not cover that. Can you explain why this preventative measure is not covered by Medicare?
So it might not be covered, or my primary care physician refers me. It's a covered benefit of Medicare, but it is covered by Medicare Part D. So the shingles, to back up, original Medicare coverage benefit by law, it covers flu as a preventative vaccine, it covers pneumococcal as a preventative vaccine, and it covers hepatitis B as a preventative vaccine. Outside of that, we would look to, and that's why we hope everybody has Medicare prescription drug coverage, or if you don't have Medicare prescription drug coverage, because you have access to a former employer or union coverage, it's going to be covered that way. Or if you're TRICARE or VA, usually TRICARE or VA will cover it, but it's going to be covered by Medicare prescription drug coverage in most cases, your shingles vaccine. So if you schedule an appointment, and I'm not sure as far as if you're still having to schedule in advance with your pharmacist, but just make sure through your plan that you have, depending on your coverage, make sure you're in network, or call the customer service number on your card to see which pharmacy might be covering the shingles vaccine and can provide the administration for that vaccine. But it's absolutely covered by Medicare, but it's covered under the Part D benefit.
All right. Here's a question then from about the Part D. It's isn't Part D premium based on income?
Great, and I'm glad you mentioned that. That's a really good point. And so Medicare Part B is in boy and Medicare Part D is in drugs can be based on income. And so what happens is if back in 2007, Congress said, we want higher income people to pay a greater share of Medicare premiums. And then in 2011, they did the same thing for Medicare prescription drug coverage. What is higher income? And that Medicare costs in original Medicare for 2021 has not been released yet, probably the end of October. If we look at past years, it's usually the end of October that we get that. But if we currently in 2020, the figures are what is higher income? $87,000 or above for an individual, or $174,000 for a couple. If we have income above that on our tax return, then Social Security will be notified by the IRS that you would be impacted by higher income Medicare premiums and you'd be contacted by the Social Security Administration. And so you would pay a greater share of Medicare Part B premium because of that higher income. And your Part D plan would also have a plan premium plus an additional amount, and that would be for that higher income amount. And there's different thresholds. There's about, I believe, 4 different thresholds for higher income. And again, it starts at $87,000 for an individual, $174,000 for a couple. And it's determined, Social Security administers it. And so if we disagree, we have to appeal that decision and that notice that we got from Social Security informing us of that through the Social Security Administration.
All right, here's another question from Mark Brackman. If you are turning 65 in 2021, does coverage start on your birthday or January 1st?
So if you're turning 65 in 2021, coverage is going to begin, usually in most cases, the day we turn 65. So for example, if your birthday happened to be on June 15th, and provided that you enrolled timely, your Medicare coverage should start on June 1st. So it's usually the first day of the calendar month that we turn 65. And for any of us that happen to have a birthday that falls on the first of the month, it would be the month previous. But otherwise, it's always the first day of the month that we turn 65, provided we have to enroll. We need to let Social Security know, hey, I want to enroll in Medicare, and here's my application to enroll in Medicare. So that's the paramount thing to making that happen.
Okay, here's another one from Bob Epstein. Joe Namath states he advertises for Medicare. New benefits have added at no additional cost, dental, vision, hearing aids, etc. Is this true or an insurance advertisement?
So it is true, but we always got to keep in mind and shop, not all plans offer all of those goodies that Joe's talking about. And so absolutely can be a benefit. And like most commercials, they're enticing and almost making it sound like, I'm going to approach this Medicare Advantage plan and they better have everything that Joe's talking about, or else. These are businesses and they only have to cover everything that's covered under original Medicare Part A and B as a minimum. But remember, I said that in Colorado, there's lots of fish in the sea, meaning there's lots of plans competing for your business. That's where they're going to start saying, hey, it behooves us to also provide these additional benefits that are being talked about, and maybe additional benefits that some plans aren't providing, and we want to make sure that we're doing that at a cost point that's going to be attractive to you as well too. So it can be, but again, it's up to each and every company how we would find out what plans might be offering these additional benefits, the plan finder. And so the plan finder can help us filter and see what are some of the additional benefits that are provided by the plans. And it could be limited benefits post-surgery, but you need to check and see what they might be. But that's why Medicare Advantage plans have become very attractive. So bottom line is yes, but it's up to each and every company, and we have to look and evaluate and see if that's right for me. And okay, I got this great transportation benefit that's going to get me from point A to point B if I need it for medical care. But oh my gosh, my prescription drugs have cost now since I changed this coverage has went through the roof. My copay to go see my doctor is quite a bit more. Don't get carried away and make sure you evaluate what's important to you.
All right, Dennis, we have a couple more questions, but they're a bit more complicated. So I'm going to unmute the person who has the question. So this question is going to be from Janine.
Okay, sure, Janine.
Go ahead, Janine. You should be unmuted. No, we are not hearing Janine. Janine, can you hear us? Send me another chat real quick. While we sort that out, I'll move on to another question that just came in. Can you change sup plan the next year without underwriting or look at any pre-existing conditions? Or do you have to stay with that plan if you want to have a sup plan and not move to Advantage plan?
So asking about Medicare supplement or another term that we use, Medigap, possibly not. If your health is questionable and you're outside of your 6-month Medigap open enrollment period, age 65 or over, and enrolled in Part B is what triggers that, and it lasts for 6 months, allows you to enroll, allows all of us to enroll in any Medicare supplement that's being sold in the state. Outside of that, there could be, and usually is, medical underwriting. If our health is good, life is good. There's a couple other opportunities that are, I mentioned them, trial rights. So if you join Medicare Advantage for the very first time when you begin Medicare, you have an additional 365 days to say, oh my gosh, I thought it sounded good. The cost was better, but I don't like the restrictions. I don't like having this network. If I want to go see a specialist, I want it to be my call. I'm going to return to original Medicare. If you're within the first 365 days of choosing Medicare Advantage for the first time when you join Medicare, yes, you could go back and purchase a Medicare supplement. And yes, we would be looking about next year since we're already in October. If you happen to exercise that today because your Medicare became effective today, let's say hypothetically. But outside of that, no. They could medically underwrite and they could say no, or they could impose a waiting period before they'll cover certain things, or they could charge you a higher premium because of your healthcare costs. The other trial right is, hypothetically, I've been sitting out on Medicare for 4 years now, but I've always been an original Medicare with the Medicare sup, and I decide in 2021 I'm going to drop it. So I'm going to go to a Medicare Advantage plan, drop my Medicare supplement. If I do that, that very first time that I did that, I would get a trial right for 365 days to say, well, this is great, or oh my gosh, and get to go back and pick up your Medicare supplement. Outside of that, it really depends. And so you need to evaluate and proceed cautiously and determine what is going to be available to you or not. And we always encourage comparison shopping, and this is what this whole presentation is about. But with the Medicare subs, if our health is questionable, we might not be able to do that comparison shopping for Medicare supplemental insurance. Now, like I said, Part D plans, Medicare Advantage plans, you're eligible, you're in, but you got to watch the subs.
All right, Dennis, we're going to try to unmute Janine one more time. And if we can't hear her, I will read her question to you.
Okay. Janine, can you hear us?
Janine. No, we're not getting Janine. Okay, but she did write in her question. This one's a little longer then, and there's 2 parts to it. So, my son has disabilities and is new to Medicare from Medicaid. I find the drug coverage we have from WellCare does not offer coverage as well as Medicaid. I've called several times and found that the WellCare plan he is on is the best option. I've looked at joining a United Health Dual Complete plan. I've been told that their drug coverage is driven by what Medicare covers. So if Medicare has a limit on a drug, will that be the case under any Advantage plan?
Here's what's happening in that situation, Janine. So Medicare Advantage plans, Medicare prescription drug plans have to cover certain drugs that are regularly taken by Medicare beneficiaries, both because of age 65 and over, or because of disability. And so they have to cover common drugs and drugs in 7 predominant categories of drugs that are out there and available to us. And they have to offer a robust formulary that covers the medications that Medicare beneficiaries require. But each and every plan can do that a little bit differently. So once we get outside of that, XYZ company could cover a particular medication and ABC might not do it. It might not be in their formulary. You might need to get an exception to do that. So you need to look at that because there are differences in how plans cover, what plans are on a particular formulary or not, and how they cover it and what costs are available. Now, if your son's sitting out there in a plan and you mentioned a particular plan, always remember you can work with your healthcare providers to get an exception if that particular drug your son might be taking is not on formulary. But each and every plan can do things a little bit differently once they have at least at a minimum provided comprehensive drug coverage for the drugs that Medicare beneficiaries require. But you really need to take a look at that. And that's where maybe in your situation, have you visited with a SHIP counselor? You might want to do that because it might be a little bit more comprehensive and they might be a little bit more familiar with a certain plan just based on SHIP counselors in Colorado become experts in how plans cover certain things or hear your son's particular needs or circumstances and be able to really focus on, hey, you might want to look at these 2 companies or these 3 plans, etc. So I don't want to pigeonhole and say that every plan is going to basically do the same thing. That's not true.
All right, she said that was helpful, so thank you. Next, we're going to call on Lloyd. He has a question, so I'm going to unmute Lloyd.
Okay,
Go ahead,
can you hear
Lloyd.
me?
Yes, we can hear you.
Good. Thanks for taking my question. It's ultimately about what Medicare considers marriage and the Part B penalties associated with being on a partner's work insurance, but it'll take me a second to get there. So I'm a para-retiree in Colorado. I have been on my partner's, her work insurance for several years now because she has Kaiser. So we made a declaration to Kaiser that we were in a common law marriage, and then that enabled me to be on her insurance.
Okay.
I have discovered on the Medicare website to a certain degree in other articles that if you're in a domestic partnership, Medicare does not recognize that as far as alleviating you from Part B penalties if you stay on spouse insurance and get off of it after you're 65. I should have said I'm going to turn 65 next March.
But
so I guess what I'm wondering is that kind of the same as having signed this affidavit for common law marriage, or what's your opinion?
So as I told you in the very beginning, and you'd think we would be, Medicare or CMS employees are not Medicare eligibility, entitlement, and enrollment experts, because that function is performed by the Social Security Administration, because they have access to our work history and information in determining our benefits, especially for retirement, but also qualifying for Medicare. I would want to work with you offline as far as the answer specifically for Medicare, but if you're para eligible, once you turn 65 and say your partner is still under 65, para provides split coverage. And so number one, they're going to require you to enroll in Medicare to maintain that benefit going forward, but you would purchase a Medicare, a para Medicare plan, and your partner would, if she's under 65, would maintain the pre-65 para Medicare plans. But ultimately, to answer your question as far as Medicare enrollment, let us work offline. Let me give you my telephone number, and let's work directly, and I can funnel your question through Social Security so that it is answered properly, because they are the experts when it comes to eligibility, entitlement, and enrollment for Medicare.
Okay.
And my telephone number, if you have a pen.
Sure, go ahead.
303-844-1994. Again, 303-844-1994. And I want to get you in touch with Social Security and communicating directly with them regarding the enrollment and eligibility question for Medicare based on your situation. But para is going to force your hand a little bit as well too. So just so that you have the answers that you need, you'll get it from the horse's mouth. So okay. Please give me a call at your convenience. And that, if I don't answer, that will go into my secure voicemail as well.
Okay. I thank you very much for giving me your number. I didn't think I was going to be forced to do it with para, but we can discuss that. That would be great.
A number one requirement on para is, and a lot of employer plans, is that we see based on your birth date that you're going to be eligible for Medicare. You are going to have to enroll in Medicare to continue on with this coverage.
Even though I'm not in a para insurance program now, I'm on her employer plan.
Gotcha. Okay. So you're not, we shouldn't even say para then. We should be saying you're on her agency insurance plan, right?
Yep. I'm on her employer plan, which has nothing to do with being in a para affiliated insurance plan.
I'm sorry, I confused that.
Oh, that's okay. I didn't make that clear in the beginning. So I just wanted to make sure that I was out there, that I was para, but I had enough to be under Social Security. So yeah. I'll talk to you later about it. That would be wonderful.
Okay, but you do want to know your ultimate question, and we'll talk about this, is how is para going to recognize that, and that coverage that's being provided through your spouse, through her employer, through her agency's employer group health plan, and if that will be considered active employer coverage, or Social Security wouldn't recognize it. But get it from the horse's mouth.
Okay, thank you very much.
You bet.
Okay, a couple more questions, Dennis. I enrolled in TRICARE for life as a result of my military retirement. Do I need to change any Medicare benefits?
So again, TRICARE for life is going to force your hand once you become Medicare eligible, meaning they're going to say, you want to continue on with TRICARE in retire or post 65, you have to enroll in Medicare coverage, because we are then going to convert to secondary coverage, and we're also going to provide your drug coverage. And a lot of times I hear TRICARE recipients receive their Medicare coverage based on your TRICARE coverage through Original Medicare. But I do know that TRICARE still recognizes and pays. I think there's you might need to individually submit it to them, but they do recognize Medicare Advantage copays and cost sharing amounts associated with it too. So ultimately, remember, Medicare is going to be your primary payer in that situation, and you'd want to make sure that your primary payer is adequately providing you the right type of coverage. I hear a lot of times Original Medicare works better for TRICARE for Life recipients, but you make sure that that's right for you, because healthcare is unique, healthcare is individualized, and we want to make sure that you get the right coverage that's right for you. And then TRICARE would be kind of wraparound coverage. Whatever Medicare coverage you have, TRICARE is going to follow it up and pay cost sharing or copay amounts associated with Medicare's what Medicare covered, and then you wouldn't have to worry about drug coverage in most cases, because TRICARE is providing adequate drug, creditable coverage for drugs.
All right. Thank you, Dennis. We have one more question from Zita. My 85-year-old husband never enrolled in Medicare Part B and has carried BC/BS. She says premiums are through the roof. Also has stage 4 kidney disease. Is there any way that he can now get Medicare B and a supplement?
Hey, Luke, could you clarify that age again for me at the very beginning? What was the age?
85.
85 and
Yep.
has never enrolled in Medicare. I'm surprised. Excuse me, Luke, did I miss something?
It says never enrolled in Medicare Part B.
Part B?
Yes.
Okay. Yeah, in that situation, then I didn't mention it because, this wasn't a understanding or a basic Medicare session, but most of us don't pay a premium for Part A. Part A hospital insurance is premium free. Every one of us will pay a premium for Medicare Part B medical insurance. It's currently $144.60 for most people, 95% of Medicare beneficiaries. 5% pay that higher amount, that income-related monthly adjustment amount, for people earning greater than $85,000 as an individual or $174,000 as a couple. And Congress also says that we want everybody enrolling in Medicare once they're eligible. And a lot of times, I mentioned TRICARE, I mentioned PARA, and I'm surprised, I'm not sure what type of Anthem coverage it is, that they didn't force the hand at age 65 as well. How Congress strongly encourages us to get Medicare is there is a 10% penalty for each 12 months that we could have enrolled and did not. And this doesn't mean people that are working or covered by active employer group coverage. This is people that are no longer working, eligible for Medicare. They need to enroll, and they need to enroll during certain periods of time. And if they don't, then in this situation, this gentleman's going to be looking at some significant 20 years at least, or a 200% penalty for his Medicare Part B. Here's what I always tell people is, what's that? Luke, was there something I missed?
No, you're good.
Okay. So with that, here's what I always tell people. Go back to Social Security and have them look at his record to make sure everything was executed and he was properly informed of this requirement when he enrolled in Medicare. Now, if he received misinformation by a government employee, a ship counselor, an agent and broker, a lot of times Social Security can take a look at those situations and circumstances. Can't promise anything, And a lot of times it's to no success, but I would always have them take a look at that in that situation, because you're looking at a very, very, very steep penalty, but it still might be worth it for healthcare coverage with health, sounds like some serious health conditions that have presented themselves in this situation. So again, if you want to use my number, you can contact me. You can reach out to me, 303-844-1994. Again, 303-844-1994. And I can get you and your information in contact with the experts for Medicare eligibility, entitlement, and enrollment. And they can take a look at his record to see if there's anything at all that can be done.
All right. One more question that just came in. If you have TRICARE for life, which doesn't cost anything, are there Advantage plans that are better for little cost?
So with Medicare Advantage, and you'll hear this, I don't think the Joe Namath commercial mentions it, but there's lots of Medicare Advantage plans. Remember, I made the statement, lots of fish in the sea, lots of competition, lots of plans offering additional goodies, extra benefits is what I mean by extra goodies, and trying to keep their costs as low as possible in the Colorado marketplace, especially along the Front Range. And so a lot of times a Medicare Advantage plan, or at least will have options, does not charge any additional premium. So there are zero premiums. I shouldn't say a lot of times. There are plans, though, in Douglas County that don't charge any additional premium. But remember, I said in order to join a Medicare Advantage plan, we have to, at a minimum, have Medicare Part A. I mentioned we don't have a premium for Part A, and Medicare Part B to be eligible to enroll. So every one of us will pay a Medicare Part B premium, regardless if we're an original Medicare or Medicare Advantage. Now, that's where I'm saying a Medicare Advantage plan, and there are quite a few options in Douglas County that there is no additional premium for that Medicare Advantage plan. Why would it be attractive? Maybe extra benefits, maybe lower out-of-pocket costs. And so it could be, even with TRICARE for life, and you have good wraparound coverage, it could be to your benefit based on your healthcare providers that you go to, et cetera, or certain other things that are in play. And so take a look at that, evaluate that. And I don't want to say exclusively, oh, TRICARE for life, you need to go to original Medicare and don't worry about Medicare. I cannot say that honestly and truthfully and be doing you justice. You need to take a look at that.
All right. One other little item of note, will you be able to provide this slideshow for us for people to view afterwards?
Always a common question. So this is a draft slide deck right now, and I mentioned this yesterday when we were doing a kind of a trial run of the presentation. So we're kind of in a dark period. This slide deck should be available, and it's much more than just the slides that I utilize. It's about maybe 36, 40 slides total is going to be available, and I'll get them to Gretchen so that it will be available to post on the Douglas County, the Seniors Council website. But just not available yet, probably looking at middle to late next week.
Okay. Great, thank you, Dennis. There are no more questions, so I believe pass it back over to Gretchen.
Okay, all I'd conclude with before Gretchen takes it over is look at the resources, and you're never alone. There's help every step of the way.
Thank you so much, Dennis. You know, you always have such a lot of vital information to share with us. And, you know, I know there are some heads spinning out there, but as you said, there are a lot of resources to help us with the next step. And I really appreciate you taking time out of your busy schedule to be with us today. But the follow-up, one reason why we're having Jean Onholt talk to us next month about the SHIP program is because that is a valuable resource. They can help you get through all of the myriad of information you receive today and that you'll be receiving in the mail. So I heartily recommend you consider making an appointment with a counselor. Our October 1st Friday update will be going out tomorrow with additional information on that presentation. If you'd like to receive this electronic newsletter or provide feedback on today's meeting, please contact us at dcseniorlife@douglas.co.us. That's dcseniorlife@douglas.co.us. Also, a quick reminder that we record these presentations. So if you'd like to hear this presentation again by Dennis or any of our others, or share it with someone who couldn't make it to our meeting today, please visit our webpage, mydougcoseniorlife.com. Again, mydougcoseniorlife.com to see our recorded presentations. We'd love for you to comment on our Facebook page or visit us on the YouTube channel. And we thank you so much for joining us. And until next time, stay healthy and stay connected.
Thank you so much.
Hey, great job, everyone. Thank you so much.
Thank you too. I think we got a lot of great questions.
We did. It'll be good to have the presentation. So, Luke, I hope we stopped when Gretchen ended, since we're chatting now. But great job, and thank you so much for your help today, Luke. You did a good job. You actually did an awesome job.